If you had a diagnosis of endometriosis or even suspected endo later in your 40s or early 50s, is it safe to take hormonal replacement, or would that cause the endo to grow back? Worse, can it cause endo to transform into cancer? I'm Dr. Steve Vasilev. Let's summarize what we know, then I'll give you my evidence-based recommendation at the end of this short video. Two recent comprehensive meta-analysis reviews, which try to find all the studies published out there and analyze them, pretty much found out really good data is simply lacking. Mostly the recommendations are based on collections of case reports, and that's considered to be very low quality scientific data. To get a definite and accurate answer would require a randomized clinical trial with a large number of patients, thousands if not tens of thousands, where half would get hormone replacement and half would not. And then, to see if there's a recurrence or a cancer, everyone would have to go through surgery. This would be totally unethical, since there would be no reason to operate on everyone other than for the sake of science and get an answer to this study. So that kind of study will probably never be done. The next best proxy for this is to see in a randomized study if symptoms like pain get worse in those who take hormones and those who do not. But since pain can be related to other things other than endo, especially as you get older, this is not a very accurate endpoint. Either way, doing a study like this would take many years to see the results. So what does the molecular science say about this problem? This is where you get blown away by the complexity of the question. The answer is that it depends on your genetics, genomics, or how the genes are expressed, epigenetics, or how bad genes can be suppressed through things like diet and lifestyle choices, how much other estrogen do you have on board through peripheral fat conversion, are the estrogen and progesterone receptors in you as an individual down or upregulated, how you're working to metabolize excess estrogen in your gut is critical, and a lot more. The decision also depends on whether or not you had active endo at menopause, or was it all excised? Do you have a family history or genetic predisposition for endo or cancer? At the end of the day, there are no studies that definitively prove that taking hormones after menopause after diagnosis of endo is dangerous. On the other hand, there are no studies that prove safety either. So it's an individual decision, but should be made after looking at all the factors in you as an individual. So yes, you could probably consider hormone replacement therapy during menopause, even with a history of endo. But it's important to weigh the risks against the potential benefits. This risk is not just for endo, but for uterine and breast cancer if you're considering estrogen alone or estrogen combined with progesterone replacement. So it is complicated, very prudent to have a detailed discussion about your particular situation with an endo expert before starting any treatment. Till next time, I'm Dr. Steve Vasilev.